attend today's webinar on achieving and leveraging interoperability, the early UPMC experience. In our time today, Dr. William Hogan will share experiences and lessons learned in planning and launching an interoperability initiative at UPMC. Dr. Hogan is a leader in the areas of systems interoperability, standards for electronic health records, and the use of information technology to improve biosurveillance. Prior to joining the University of Arkansas, Dr. Hogan was the Associate Medical Director of Clinical Information Systems at UPMC Health System. He became an Assistant Professor of Medicine in 2002 and Biomedical Informatics in 2006. In 2007, he was promoted to Associate Professor and also began serving as the Director of Medical Vocabulary and Ontology Services at UPMC. We trust that you'll receive great value from your time investment today. Before I hand the presentation over to Dr. Hogan, I want to cover off on just a couple of housekeeping items. Today's webinar is being sponsored and hosted by 5-Star Development in conjunction with the Western PA chapter of HIMSS and HFMA of Western Pennsylvania. 5-Star is a Pittsburgh-based consulting company that partners with healthcare organizations to identify and remove obstacles hindering clinician buy-in and adoption for critical strategies and initiatives to improve patient care. 5-Star has enabled clients to successfully implement new work processes and technologies like EHR and CPOE by providing change management, communications planning consulting, custom training and learning development, and on-the-job web portals. Visit 5stardev.com to learn more. To learn more about the Western PA chapter of HIMSS or to become a member, please visit their website at wphimss.org. And also, to learn more about HFMA of Western Pennsylvania, please visit wphfma.org. Next, in our effort to make this webinar as interactive as possible, we will make use of polls. Once a poll is launched, simply select your answer and hit submit. It's that simple. If you have any challenges or questions, please submit them using the question chat box. We'll be using the question chat box throughout today's presentation as well to gather your feedback and ideas. This box can be found by expanding the menu interface and typing a response into the box. So let's test this functionality real quick. If you could type in where you're from right now in the question chat box, that would be great. So we got Pittsburgh. I have a number of people from Pittsburgh. A number of people. St. Margaret's, Bethlehem. Great. So it works. Thanks for submitting those in. You'll also receive a link with today's slides after today's presentation, and this link will come to you in the form of an email. And finally, at the end of the webinar today, we'll be asking for your feedback in the form of a survey. We greatly appreciate and value your opinions because this will help HIMSS and 5-Star improve our webinars going forward. So now that we got these items covered, let's hand the presentation over to Dr. Hogan. So Bill, why don't you take it away?
Thank you, Justin. I appreciate that introduction and setting the stage for the webinar. I want to thank everybody who took the time out to attend the webinar today, and I want to thank Western Pennsylvania HIMSS and HFMA of Western Pennsylvania for organizing the webinar and inviting me to present. This is work that I am very proud of and enjoy talking about, and it's always a privilege to communicate to people the great work that was done with a great team of colleagues, and it's always a privilege to represent them. And I hope that some of them are here with us today as well. So as we go through the presentation, we have a number of quick polls. So Justin, if you want to take over momentarily.
Sure. The poll has been launched. So the question here is, what is your role in the interoperability process within your organization?
Okay, great.
So we're gathering a number of responses now. Okay, about another 25 seconds, we'll have the poll open. Okay, we'll give you a couple more seconds here. Okay, I'm going to close the poll, and I'll share these results.
Great. So the fundamental problem we were trying to solve with the interoperability project at UPMC was essentially to integrate information across a diverse and geographically widespread enterprise comprised of 15 or more acute care hospitals, 17 long-term care facilities, over 400 ambulatory sites with 2,500 physicians practicing at those sites, an urgent care center that recently opened, over 40 cancer centers spread over western Pennsylvania, a health plan, a home care agency, and several pharmacies, as well as numerous other sites that are too numerous to fit on a graphic slide like this. And again, the challenge was to integrate information across this whole diverse enterprise. And the question was how to do it. But first, what are some of the reasons for integrating information across the enterprise? It may seem obvious, but some of the key challenges we were facing were risks to patient safety. We had an EMR system an electronic medical record system from one vendor in the inpatient setting and from another vendor in the outpatient setting that did not share data, which led to a number of potential safety issues around allergies and medications, and I'll talk a lot about that as I go through the presentation. Lack of integrated information is also a barrier to measuring and improving the quality of care, which is something I think all of our organizations are interested in doing, both for especially for ethical purposes, but also for regulatory and reimbursement purposes. Lack of integration also leads to inefficiency. Multiple providers re-entering the same data over and over into disparate systems represents a substantial inefficiency in personnel time and human resources. And finally, we found that lack of integration of information was a significant source of patient dissatisfaction. Our patients tell us over and over that one of the chief sources of their frustration is that we continuously ask them to fill out paper forms every time they come into contact with our healthcare system. And these paper forms collect and require the same information over and over again. And since we started the project, as of last year, a lack of integration is also now a barrier to meeting the meaningful use criteria under the HITECH Act, where if you don't become a meaningful user of electronic medical records, you will miss out on incentive payments to your hospital and to your physician practices, and after 5 years you will also then have a cut in reimbursement. So now I'm just going to illustrate one of those problems with the lack of integration without interoperability and show you